Hello, YouTube. What's up? My name is Ellie, and I'm a non-binary trans guy. I've been documenting my journey with gender and transitioning. I've been on testosterone for the past 3 and some years, and today we're doing something a little bit special. We've got Niki here. Niki, I am really bad with your last name.
Panoyas.
Panoyas. Okay, so we got Niki Panoyas here. Oh God, I butchered that. And we're gonna talk about some stuff that we have in common that are gonna be top surgery related. Hopefully, we can get to some non-binary definition related. And did I say surgery? I said surgery. And testosterone stuff. And there's a shitload more. I just don't want to build up expectations for the stuff we might not be able to get to today. But if it goes great, we might do another one. Okay, so first off, y'all know me because I'm here all the time. Niki, why don't you tell us a little bit about yourself?
Sure. So the reason we're making this video really is because I commented on one of your videos in 2019 because I was going through a similar journey. Mine started much later though. I've only been on testosterone for 15 months now. And your content, I would say, has really encouraged me to do so because, like, there wasn't really any information out there on low dose testosterone. And since then, I've been in therapy, I've had top surgery, I've had a hysterectomy. And this has, of course, made my environment and me myself ask, do I still identify as non-binary? Am I binary now? Am I a trans guy? So back, so forth. And yeah, we're going to talk about that today a little bit. And okay. I'm going to give a heads up. I live in Germany. I have Greek and German citizenship, and I decided to transition in Germany because this is where I lived, and this ended up being much less complicated, but still very complicated.
So just to clear things up on that level, I'm Israeli. I only have an Israeli citizenship right now, God damn it. But we're working on it. And I decided to transition in Spain for the most part, because it's actually a lot less complicated. Yeah, so let's start with top surgery. So I'm counting down to top surgery. My surgery is in 59 days. Like, oh, this is very close. It's very close. It's less than 60. So 60 is like a round number. It isn't a round number anymore. Okay. And I'm going to have double mastectomy with 3 nipple grafts, which means I'm probably going to lose sensation in the nipples. And is that the same procedure that you had?
Yeah. I've had double incision with 3 nipple grafts because my breasts originally were large enough to warrant that. You can only get away with periareola or with keyhole when you have really not a lot of tissue and really good. Well, let's say like this: when the skin is not sagging, when you don't have any complication, that's when you get that. And other than that, getting 2 large cuts is really inevitable.
So what they call the sagging, the medical term is ptosis.
Yeah.
And ptosis has degrees, but mine is like 3, which I don't know what 1 and 2 look like, but 3 you can comfortably hold a pencil under it. I mean, like it's a significant skin fold. And if you were to just lipo the breast tissue out of it, you would be left with we should content warning this shit. Okay, so content warning. Niki and I swear a lot. And we're going to talk about procedures, which are graphic because they contain descriptions of incisions. We're going to talk about recovery from top surgery, which might be painful. And we're going to talk about breasts because they are part of top surgery. We might even... I love you, man. We might even discuss bottom stuff, though I don't know to what extent. So if any of that if any of that bothers you, I'm deeply sorry that it does. And you might want to turn off the video. So, okay, so going back to the discussion about breast tissue. Okay, so where was I going with that? Okay, so there are like, if I understand it, 3 or 4 major kinds of top surgery. So the first one would be peri-areola, which means that they do a nifty little cut around the areola of your existing nipple, take all the breast tissue out and close it down. And that's it. You're just left with the same areola and the same location at the same height that you've had before. You have most of your sensation left. And that's good if you have no ptosis. And the second kind that I've heard is buttonhole. Are you familiar with that?
Yeah, or keyhole, same thing, yeah.
So buttonhole or keyhole is when they actually cut around the nipple, but they don't completely detach it. And they kind of take out most of the breast tissue, but not all of it, relocate the nipple into a hole that they make. And this is why it's called button or keyhole, because they kind of thread the nipple through the hole, and then you have a cut that's actually much lower than the nipple itself, which aesthetically I don't find as pleasing as the other 2 kinds of surgery, which are either scars at the height of your pec or no scars. Yeah. And these tend to be scars more along where your ribs are, just because of the way that breast tissue accumulates in female, like estrogen bodies. Okay, and then the last one, which Niki, you've had and I'm going to have, is the one where they just remove the entire breast tissue, cut out the nipple, and just put it where they want to put it, which is double incision. Now, if I've missed anything, there's lots of different ways to make these incisions, lots of different kinds of scarring. And yeah, Niki, what was it like?
So I've had a consultation in December 2019 with someone I really had my eyes set on. Mm-hmm. The reason I had my eyes set on him is, first of all, he was able to offer a combined procedure where he would either do one of those minimally invasive types of top surgery you mentioned, or double incision with a hysterectomy if you want to. Mm. I went there, he showed me his results. He's one of the most famous surgeons here. His name is Dr. Schwarz, and he's in Northeast Germany. I saw his results and the complications. He showed me his best, his worst results. Let's say it like this, his worst results still looked amazing to me. He answered every question I had. I really drilled him. I went there with a list and we sat there for 2 hours, I think. Wow. And yeah, he showed me photos of the surgery itself and of the results, and he explained everything to me. He said to me, if it's okay with you, I would like to look at your tissue. If not, you can send me photos before the surgery. And then I'm going to write down what technique I need to use on you. Because it does depend on ptosis, on size, elasticity, so on. Okay. So we did that. I had a really good feeling about it. And I made the first appointment he was able to give. And that was February 2021. So I ended up waiting 14 months for the first appointment. A lot of this waiting time was also spent fighting with insurance, which is something we can talk about later.
Yeah, we could mention that later. That's actually quite important.
Yeah. So I checked into the clinic on February 1st, the day before the surgery. We do corona tests and whatnot, blood tests. And I think it's finally happening, you know. But then my blood levels didn't come back perfect and I had some infection. They weren't able to pinpoint what that was. So I needed to have an x-ray right there in the clinic. I think we did 12 blood tests over the course of a week. Really, it was way too much. And one of the doctors there said, we might send you home tomorrow rather than operate on you. And I said, well, look, I drove for 3 hours and I've waited for this appointment for over a year. What's wrong? And they just weren't able to pinpoint that. And when my surgeon came into my room that night, I was really distressed. And he said, are you feeling bad? Like, do you have a cold? Your COVID test came back negative. I said, honestly, other than being tired and stressed, all is good. He really started arguing with people in the clinic. He said, we cannot send this guy home. That's ridiculous. Because of blood work, that's not perfect. Nobody has perfect blood work, he says. He says to me, listen, calm down. Tomorrow morning, I come here. You get up at 5 a.m. and I draw on your chest. I draw where I make the incisions. I'm going to come here and act as if everything is normal. We're going to figure it out. And they make me go to sleep like that, right? I have no idea whether the surgery is going to happen the next morning. Okay, I get up, take a shower. Like he says, he draws on me, all is good. He asked me again, are you feeling fine? I said, great. He says, okay, I'm going to talk to my colleagues. An hour before surgery, one of the people there, one of the nurses comes in and says, yeah, we're going to operate on you. And at that point, my nerves are shot. I'm not nervous because of the surgery. I'm nervous that it's not happening. And they asked me, do you want a pill to calm down or anything? I say, no, thank you. All good. Then a guy knocks on my door and says, get ready. We're going to come to get you now. And I'm wheeled into surgery in my bed. And people ask me, who are you? What are you here for? And I say, if it's going really well, I'm going to get double incision mastectomy and a hysterectomy. If it's going not so well, breast augmentation, who knows? And they say, okay, you're in good spirits. Okay, let's do this.
That's priceless. Okay.
My surgeon comes to me and takes my hand and says, don't be scared. The worst thing is behind you now. And that's really the last thing I remember. I wake up 2 hours later. They operated on me for 2 hours. And I'm not in pain or anything. I'm just numb because, all the nerves are disconnected. I'm just numb and I'm lying in bed there and I can barely keep my eyes open because I'm so tired. And my chest feels really tight because I have a compression vest on and whatnot. And my surgeon storms in and, hey, how are you doing, man? Great. I did a perfect job. Everything went great. And I don't remember most of what he said because I was so tired. But I remember asking him, did you cut it? Did you remove everything? He says, yeah, of course, everything's gone. And then really, I wake up 3 or 4 hours later. I was so knocked out. I woke up in my room the next time when one of the nurses hands me a phone and says, your mom is calling. She's worried you have died. I mean, I'm sorry, Mom. I was in surgery. I can get to my phone. And again, I don't really recall what she said, but I just said, Mom, I'm fine. It worked. I'm going to call you back tomorrow. Then I had a couple of friends call me and I said, tomorrow I can talk now. And I woke up really early the next day. Couldn't really see my result because the compression vest was really thick and you're not supposed to tamper with that. But they woke me up to bring me breakfast. And I could barely sit up, but I was so happy. And I had drains and that was a little bit uncomfortable, but I was just so happy, so tired, but so happy. And the next day they opened that vest up a little bit to take a photo for me. It was still very swollen and I had bandages on, but just to show me this really did happen because I kept asking, did everything go as planned? Like, is it really gone? Yeah.
So just to be sure, you went and did this alone? You were alone the whole time?
Sure. We weren't allowed to have visitors or have anyone drop us off there because of COVID. They said the only way that we can keep having regular traffic here and that the appointments keep happening is if we only let in one patient at a time and we don't risk bringing in infected people.
God damn.
Yeah. So I only ever had nurses and my surgeon come in a couple of times a day to check in whether everything was fine.
Oh, wow. And just because I'm a physical therapist, I have to ask this. Did you walk the same day that they woke you up from the surgery? Did you get up and walk?
I walked 3 or 4 hours after the surgery, and I squatted down and I bent over.
Okay.
Not to make a point, just accidentally, because I wanted to put on a pair of socks. And I didn't think about it, and I squat down, and I'm thinking, oh man, I probably should not have done that, because like I said, I also had a hysterectomy and I didn't want my bladder to fall out. And I asked my surgeon the next time I saw him. He says, no, don't worry, you can squat, you can bend over, it's all fine. And I even washed my own hair over the sink in the clinic, so that was all fine. Yeah, I was walking around the same night.
Jesus, wow. Okay, so you're also somewhat of an athlete, right? So surgery meant that you had to stop training, and that you had to kind of gradually go back into that. So if you want to talk about like early healing and how that was for you.
Sure. So I used to do bodybuilding as a teenager. I've been doing powerlifting for many years now. I'm 28 now. I've been doing this since I was 21. So it's a very big part of my life.
It's really important that you say your age, because nobody has a fucking clue how old we are.
I look 12. I know. I'm 28, guys. Thank you.
And I look 23, and I'm 35.
That's a good thing, though. That's a good thing.
Not complaining.
Yeah.
Okay. So bodybuilding, powerlifting.
So training was a really big thing for me before I transitioned, because I experienced a lot of chronic pain and chronic illness growing up, and that just helped me to deal with it. And then, of course, it was also a means to masculinize myself before I even went on TRT. Build some muscle, feel strong, whatever. And the last couple of weeks leading up to surgery were really just taking the steam out of a little bit, calming down, just focusing on one thing so I don't go completely crazy. But I knew, of course, that at least for a couple of weeks after surgery, I would have to pause completely. Not do light things, do no things. Just sit back and recover. And like I said, my surgery was on February 2nd. I started training again 12 weeks afterwards. I was cleared by my surgeon to start training 6 weeks after surgery, but I felt too tired. I was walking the dog and I was sweating and I was feeling nauseous. And I figure, I know I'm going to train for the rest of my life in one way or another. Best not rush this and then end up really regretting it. Because when you get back into training after such a major surgery, as far as top surgery is concerned, everyone is scared for their scars, that they don't widen, that they don't stretch, that they don't burst open. But when you've also had lower body surgery, be this a hysterectomy or phalloplasty or mega or anything, the problem is you also have internal stitching. You really don't want to burst that stitching.
So I'm just gonna pause for 1 second and explain why that's relevant to weightlifting, because that's actually a little bit of an important piece of information that I don't know if everybody has their head around. So the way the stomach works is it has a certain amount of pressure. And whenever you want to use your limbs, you need to transfer force from your lower limb to your upper limb, or from your upper limb to your lower limb. Usually when your feet are on the ground, you're going from your lower limb up through the torso to your upper limb. For example, if you're doing weights, what usually happens is you grab these things by your hands and you do the actual work with your feet. So you have to move a certain weight, and in your case, it's actually quite high weights. Like I've seen you do 100 kilos and upwards. Did you get almost, like, what's your highest number on any lift?
I've done 120 kilo deadlifts.
Okay, so 120 kilo deadlift. So that's really a lot of weight. And how much do you weigh, more or less?
At that point, I was around 60 kilos, so that's twice my body weight.
So twice your body weight. Okay, so you want to move twice your body weight with your lower limb, holding onto it by your upper limb. So what happens is this amount of force that is equal to at least 122 kilos needs to go through your spine down to your legs. Now, as it goes from your legs into the ground, it's fine. But when you go from the legs into the chest, you actually have to go through the stomach. So if the stomach is not a very condensed unit, that force will disperse. So in weightlifting, what they do, which I imagine you can explain better than me, is called bracing. So bracing is actually a very strong activation of the entire group of muscles that goes around the abdomen and the diaphragm and the pelvic floor. And what you do is you squeeze all that shit in just to make it tight, so your abdomen can channel the force going from your lower limb to your upper limb. Now, what Niki said, and is really, really, really important, is when you remove basically the uterus, you are leaving a lot of like stitches, which are basically open cuts of tissue are held together by some kind of exterior material. And if there's one thing you don't want to do with two pieces of material that are held together by something weak, is put a shit ton of pressure on them, because what it might do is it might actually separate the union that they have. So it makes a lot of sense for someone who's in a sport that exercises such huge powers to actually take their sweet time waiting to recover from lower surgery, especially if they have internal sutures, which I'm not sure that all lower surgeries have, because I'm not a big on the issue, but it actually makes perfect sense. And I would highly advise that anyone who goes through a hysterectomy really makes sure that they know the limitations on going back to their particular sports, because in Niki's case, it makes a lot of sense that the limitations are a lot more severe than if he were, let's say, a jogger.
Yeah. I think to sum that up, I would explain to people who are not into this, you are dealing with external forces and internal pressure. And I was just thinking about this because we said kilo, and at the end of the day, many of our viewers might end up only using imperial units. But I was saying at that time, I was weighing around 132 pounds. And this deadlift that we spoke about was 264 pounds. That's not very strong. All my friends are stronger. I haven't been on T for long. Most of it is really...
I can't lift that.
No,
I cannot lift that.
Stronger. It's not very strong in powerlifting at all. Not at all. All the girls I'm training with are doing 400 pounds and more. So it's still mostly estrogen gains because I've only been on T for 50 months, but I'm working on it. Yeah. So, my surgeon, because I'm going to use anatomical language here. Yes, I had my uterus removed. I also had my cervix removed. He asked me whether I would like to keep that in. I said, no, thank you. Everything comes out. And what he does then is he stitches the vaginal cuff up from the inside. And that's what I meant with internal sutures. So it's not just my abdominal scar, that was kind of the hysterectomy I've had through my abdomen. It's not just that scar could open, but we're really talking about what's internal. And you're going to have a really bad time if that happens, especially, may I say, if you have to seek medical attention as a trans person. I think it's bad enough for a woman when she has something like that happening. I didn't want to risk it.
So do you mind like just commenting why you feel it's different to seek medical attention as a transgender person where you're living as opposed to a cis person?
Sure. I actually ended up staying 6 days in the hospital because we don't have trans care here where I live. Don't get me wrong, I've met a doctor, one who was supportive of me and all, but mostly you're turned away with, I don't have experience with that, or I'm not comfortable with that. And I asked my surgeon during the consultation what could go wrong and where do I go if something goes wrong. He says, well, worst case scenario, if you find no one and if you're not bleeding out in the time, you come back here. 3-hour drive is not practical when you're having an emergency. At the end of the day, I would have needed to go to a local hospital and say, guys, I have this anatomy, but please be mindful. I've had this and that surgery and I identify this and that. And in my experience so far, it's not being respected at all. And I don't want to deal with dysphoria and I don't want to deal with medical trauma when I need help very desperately, very urgently. And that's why I stayed longer, that if I really experienced complications, people who are mindful of that can immediately help me. That was my line of thinking there, because a lot of people are released 1 or 2 days after top surgery.
That actually makes a lot of sense, because what it sounds like to me, Niki, is that like the doctors that are available to you where you are might not actually give you adequate care, which is really scary post-op. Yeah.
It was bad before surgery already, and I figured after isn't a better time exactly. So
actually in Israel, I don't know what % of the doctors would be trans friendly. And I'm glad I don't have to find out. But when I was doing some of the tests that I thought that I would have to get in order to get surgery in Israel, I got a lot of nice responses. Like I had to do an ultrasound of the breast, and I go into this waiting room, right? And it's this waiting room in a really religious part of Tel Aviv, which is Bnei Brak. Bnei Brak is like a city within a city, right? It's, I guess everybody's seen like the really Orthodox Jews, the ones that walk around with like the black coats. So it's that kind of place. And I really needed my dates to be within the time that I was visiting Israel. So I had to take whatever was available, right? And for some reason, they have really a lot of medical services offered in that community. So I ended up going there. And the waiting room was packed with women in, I guess you could say, religiously modest clothing, and me. So I go into the room and the doctor kind of half looks at me and says, "You're in the wrong place."
yeah.
So I sit down and I say, "No, doctor, I'm in the right place. I have breasts and I need an ultrasound for them because I'm getting top surgery." So she said, "What?" I said, "I'm having my breasts removed." So she says, "Why?" So I said, "I'm a transgender man." She says, "Oh, you want to be a man?" I said, "No, I am a transgender man." And she says, "Okay." And like in a second, like her conduct just, she wasn't that nice to begin with, but after we had that little back and forth, it was a little less friendly.
This is so relatable here, because I know you said this to me before. Germany has this really progressive reputation. You think everyone is going to be kind and understanding and really helpful. Ask people who've gone through the legal and the medical process here, and they'll probably tell a different story. But yeah, very relatable.
Okay, so before we jump into the insurance stuff, just in terms of training, like how did you ramp back up? I think a lot of people don't know what it means to start slow or what it means to build up.
Sure. So the first thing that I did was take my chest out of the equation and just see how can I move my arms without weights, just moving them up, down to the sides without stretching the chest. And I figured out, okay, I can do lower body movements, no problem. Got to see how I incorporate the upper body back into. So I obviously didn't start with 120 kilos again. I just took the empty barbell, which is 20 kilos or 45 pounds, and just moved with it without moving my arms. And it felt really solid after 12 weeks. I wasn't exhausted. I definitely wasn't in any pain, and I was confident. And that's what was important to me. I'm experienced enough that I can say, when I feel confident about a movement, it's probably going to go really well. And of course, I got really sore from just moving around a little bit with it. And I was clever enough that I did that on a Friday because I had wanted to start training on a Monday. So on Friday, I try this and see how does it feel. And Saturday and Sunday, I'm so sore because I haven't really moved in 12 weeks, right? I was just playing video games. So I repeat those movements I did on Friday, and that really helps with soreness. Like if you get sore from push-ups, for example, and you do more push-ups the next day, that's probably gonna help. So by Monday, I felt really fit, is what I'm saying. And I just started adding a little bit of weight and just started doing really light deadlifts. And then the next day, I took some exercise bands and some tube bands and just started moving around a little bit without moving my arms overhead, just out and to the sides. Later, I did a couple of curls, a couple of press downs, just to see how are the arms feeling and is anything stretching in my chest while I'm doing something with a little bit of resistance. Because there is a difference whether you are just moving your body with no resistance or you are adding that in, be it with a band or with weights.
Yeah,
and
that's...
the next step is going to be, because I've spoken with my coach and with a couple of other coaches, that we gradually incorporate more movements that stress the chest and the arms. So for example, a bench press. But rather than immediately starting with a regular bench press, we will try to shorten the range of motion. Things like that. And this is something that now that I've done some isolation exercises for my arms that I'm going to start incorporating the next weeks. And I'm using my Instagram account as a training log, like a lot of people are doing it. And once I'm done with recovery, because what this really is, it's not training at this point, it's rehab. Once that's done, I'm definitely going to make a YouTube video detailing what I did on which day and what that felt like. Because I know for a lot of non-binary people, for a lot of trans guys, this question, when can I train again? When can I lift again? Is really big and it's not being answered. My surgeon said, I don't know, I don't lift, you know? I said, yeah, I see that. And he said to me, as far as I'm concerned, you can start benching again after 6 weeks. And I said, I'm not going to bench again after 6 weeks. I don't think so. That's not a good idea, you know? So yeah, I know that it's very lacking information out there, and I'm definitely going to create content about it, but I would like to do so after the fact, instead of spamming my YouTube channel with random training clips of me, I don't know, taking a band and curling it a couple of times. That's not really helping anyone.
I think that's it's immensely important. It's immensely important to have some kind of reference for people's rehab from top surgery. So really, as a physical therapist, this is something that I'm very focused on, that I want to get done when I'm recovering from surgery. I think because I don't have the added component of having bottom surgery at the same time. I'm just having like, your run-of-the-mill double mastectomy, then I'm gonna maybe be able to do like some general content. And the thing is, for me, my sport is about hanging from my arms. So hanging from my arms, I'm gonna need full range of motion. My hand is gonna have to go all the way up here. I'm gonna have to be able to like support my entire body weight on my arms. Some of the exercises is supporting your entire body weight on one arm, and swinging around a lot and being upside down. So I think it would be really, really, really cool if we could kind of put these things together, because if you're probably going to do a lot more lower body than me, and I'm probably going to do a lot more upper body than you, it's going to be very interesting. There is one case study that I'm aware of a guy named S in San Francisco who worked with a physical therapy named Jen. And Jen she's a circus physical therapist, and the guy does straps, which is actually what I do. So I'm going to build on what they did and credit them, of course, and try to see if I can throw my own 2 cents in it. And that's the cat. The cat is awake. She's probably going to want me to open the door soon. Okay, cool. So we've got that down. And we have so much more shit to talk about. I think one of the things that people really want to know would be like testosterone dosages. I get asked that shit all the time.
Definitely. But let me interject real quick.
Yeah, go ahead.
Because I didn't tape this morning. I'm still taping my scars, and I thought maybe you guys would want to see my result.
Yes, we want to see your results.
I'm not taped up right now, and that would offer itself essentially.
Bring it on.
I'm doing it. Okay. Oh, and I'm going to narrate this and say, guys, remember, I'm not doing bodybuilding. I'm doing powerlifting. I'm fat.
Oh, shut up. Like, I think at this point, everybody watching here is just that we just want to see how flat it is. Yes.
Yeah. You can see that. Yeah.
That is a nice result, my man.
So I have no traps, I'm sorry, but you can see that that's my pec naturally. And my, I'm actually going to stand up. My double incisions, they go a little bit here under my armpit, but not all the way back. And my areolas were cut out with the cookie cutters, my surgeon joked. And they are stored during the surgery, and then they sew them back on. So that's a transplant, right? And one thing that actually happened to me was my nipples, so not the areola, but the piece on top, both of them fell off during recovery. That's a really common complication with some surgeons. They could grow back, I was told. But I think had I not mentioned it, no one would have noticed. In my opinion.
Yeah, I'm with you on that one, because I'm like looking at it and I can't really tell, you know?
You can see here, it's in my opinion, a natural looking chest. And I did have complications. I have a little bit of hypertrophic scarring, which is when the scar raises. It has nothing to do with what kind of surgery you're having or which surgeon did it. It's just how your body processes the whole thing. And I have problems with that in general. You can also get keloids, which is when the scar spreads beyond the original incision. And that's something that happened to my areolas. So because I had a transplant here, and I wasn't really reacting well to the stitches, I don't know, it started spreading a little bit around the edges. But again, it's not something you would notice if I didn't give you a close-up of it. And my surgeon prescribed me a gel for it, a silicone-free gel, because silicone can flatten but also widen scars. And we don't want the scars to get wider. And I've been putting that on. And because of that, it's not as raised any longer. So it's working as intended. And another complication I'm having is I have dog ears, which is when there's a little bit of excess tissue. Again, that's not something you can diet or train away. That's something that just always is a risk with double incision. No matter what your body fat percentage is, your weight is, no matter how large your chest was to begin with, it's just something that's a really common complication. But good news is, a revision for it is really, in most cases, a 10-minute thing where your surgeon would just snip that off and then you're good to go. It's really just extending the scars. And this is just to say, I'm happy with my result. It's not perfect because of how it healed. The surgeon did an amazing job. And I think those are all things you wouldn't necessarily think to yourself, like, oh, something's wrong there, something didn't heal properly there, when you're not right up in front of it, you know? So yeah, that's bad.
I would be thrilled to have your kind of results with all the complications you mentioned and everything. I would take that with both hands and say thank you.
Yeah.
I always do this anyway, but I think it's like shirt off time, right? So
yeah.
Okay, so basically, yeah, so this is what we're dealing with. I don't have a lot of breast tissue at the moment, but there is a skin fold. Like if I double the binder under the breast, you can see there's a bit of a skin fold. My nipples are around here at the moment. They need to be here. on the same height. But yeah, like you said, Niki, like I've been told by doctors that because I don't have a lot of fat tissue on the sides, that the cut is really going to be like up to here, and that they're not going to drag it into the armpit. And speaking with a colleague of mine that's also a physical therapist, it was explained to me that this actually is a very good thing for range of motion afterwards. So there is one thing that I would ask you is, would you mind like showing us like range of motion, like how far up can you take your hands and all the rest of it? Yeah. And
yeah, it's all good. I'm just not trying to push it too far with weight. I haven't pushed my arms overhead with a bar or anything, or with resistance band. That's really something that I'm keeping at around the nose level at most until I'm fully comfortable with that. But I started moving my arms in the hospital already. You know, first night, second day, had a good range of motion already there.
Nice. So is that full range of motion for you?
No. I'm sure if I really push it out, I could put them way overhead with elbows straight. But like I said, I don't want to stress it yet because I'm feeling a little bit of a pull in the scar tissue.
I'm going to open the door for the cat because she's being a cat. Yeah, so that's something to take into consideration. Like if you're an upper body athlete or you just do upper body sports, then the range of motion from here to here is going to take a while.
Yeah.
You know, because what this does is it really stretches out the chest. So as you can see, like you can almost see like the fabric here, the fabric is kind of loose, and then the fabric of the binder here is kind of stretched. The same thing is happening with your skin. And it's going to take a fucking while. Also, when you take your arm backwards, there's also a stretch, not as big, but everything that has to do with like push-ups or dips is going to have to wait a little bit. And this is actually where I have a bit of a disagreement with a lot of people who don't want to stretch their scars. I would actually like to stretch my scars because I want a functional scar. I want to end up with a scar that lets me do all the range of motion that I currently have, even if it's not as pretty, because for my life, for my professional and athletic life, that's actually a lot more meaningful than having like two neat little lines on my chest. Yeah. So I'm going to try and push my doctor to let me move around a little bit earlier and do a little bit more range of motion, even if it does cause like a minor stretching. Yeah, and we'll see how that goes. I heard that one of the big ones is that you cannot elevate your heart rate. Did they say that to you?
No. My surgeon said to just take it easy for 6 weeks. Don't strain too much. But he said he's had people who are jogging after 3 weeks and whatnot.
Okay.
So I'm going to tell you, I share your thoughts with it. Really stretching the scar tissue is better. Get full range of motion back. The only reason I didn't end up doing this now is because I've actually had 4 open spots on my incisions. Like I said, I don't have the best wound healing. I knew this before, and I've had little holes essentially in the scars, and
yeah,
that sucked. So I figured, whatever, not push it too far. I can absolutely stretch my arms overhead, raise them completely. But considering I already had hypertrophic scars maybe a month after surgery, I didn't want them to be raised, so essentially thick and wide. You know, I figured either widen them or thicken them, but if possible, not both at the same time. But you never know what you get with it.
Life is a box of chocolates.
It's also something that my surgeon said to me. Sure, you can not take the best care of yourself and threaten your result with that, so to speak. But at the end of the day, how your body decides to heal, you can wrap yourself in cotton for the next 3 months and still get very, very, very wide scars.
And what I've seen with a lot of guys who have like suboptimal healing is that most of them are happy anyway. Because
Fully agree.
your tits are gone.
We also have to keep in mind scars fade with time. They're not always going to be bright red or pink.
I actually want to take the chance and I share that I've had another surgery about 6 years ago. It was a back surgery, and I just want to show people what a 6-year-old scar looks like. And take into consideration this was a much bigger operation than the breast one. Okay, so I've had spinal fusion, and this is the scar.
Yeah, that's barely noticeable.
Yeah, and this stuff was a lot more prominent when I just had it, like it was distinguishable from a distance. But because this area of my body doesn't get a lot of sunshine, not that any of me gets a lot of sunshine, not a sunshine guy, and because I've been training basically from the moment that I could, so this scar is both functional and kind of faded. And the moral of the story is, it's just, just after you've healed, just don't be afraid, live your life. It's fine.
I also have a scar from 2016 on my shoulder. You can't really, you can't make that out, not on video at least. It's also something that was hypertrophic, was really thick, was really dark red for a year or so, and whatever.
I mean, it's kind of funny. It's like you have the sun thing, right? Because like you get top surgery in summer, and the first thing you want to do is you want to go to the beach, you want to take your shirt off, and you want everybody to see your flat chest.
Yeah. Forget about it.
And it's like, for me, it's like doubly funny because like I moved from a country where taking your shirt off for men is like the most normalized thing in the world to a country where this is frowned upon. Yeah. It's like in Barcelona, it's not a really cool thing. If you're a guy, you don't take your shirt off in public. It's like kind of like machista,
Mm-hmm.
Yeah.
It's funny you mentioned that because I had images of Greek men of all ages, boys or grandpas, sitting around on the streets shirtless. And I asked my German friends, is that okay? And they said, no, never. I said, okay, what about your own backyard? No, someone could see. That's antisocial. Okay. What if we go to the beach? Maybe if we go into the water. Okay. It's a cultural difference, right?
Wow. Okay, so in Israel, if you're hot, you take your shirt off.
Yeah, I know.
And it's hot all the time. So basically, the only reason people don't take their shirt off is because they don't feel comfortable with their own bodies,
Yeah.
Like society can have, amazing. Oh my God. So let's do the testosterone bit. Huh?
Yeah. Do you want to see whether it has been recording all this time?
It's been recording all this time. I'm not sure how long we've been on anyways. It's now 4:30, and I guess we started a while ago. Okay, so what do you say? You want to pause here and continue? Yeah?
Yeah,
okay.
That's right.
Okay, everybody. So thanks so much to Niki for sharing his experience. And this is like the first time that we're doing this. If it goes well, we'll do it again. And if it doesn't go well, then we'll just do it over the phone because we're chilling out anyways. And any parting words, Niki, that you want to tell people out there?
Nothing that comes to mind. Guys, if there's any questions you have, ask me in the comments. I'm reading them on Ellie's channel. I'm going to do my best to be as detailed as possible. I'm not the best speaker. I write better than I speak. And yeah, don't hold back.
You're pretty good at the whole talking thing. Don't worry. All right, man. It was a pleasure. It was an honor. I really think this sort of thing is important because I really think like there's not a lot of panels out there. Like I've seen a lot of guys like putting their stuff out there, but it's mostly like personal things. And I haven't seen a lot of like back and forth between people. So this wasn't a very relaxed, chill out kind of stream, because I think we're talking about like a very structured thing. Like we wanna get the information out there more than anything else. But I am looking forward to just throwing concepts back and forth. And nothing. Thank you so much. This is going up on the channel hopefully today. And GoFundMe link in the description. I didn't say it at the beginning. I have to say this in the beginning. GoFundMe link to my top surgery in the description box below. Thank you, Niki. And see you guys next time.